So Karlea Abel is the Vice President of Health Advancement at the Community Health Center of Southeast Kansas, and that's located in Pittsburgh. The Health Advancement Department works with communities in rural Southeast Kansas on the social determinants of health, helping their patients with transportation, food, housing, and barriers to a healthy life. Karlea has a Master's of Public Health from George Washington University, and she's presenting today on the effects of poverty on the health of the community. So please join me in welcoming Karlea.
Awesome. Thank you so much. And I'm very excited to be here today and talk with all of you, especially on Zoom too. So, since we have a Zoom environment, feel free to ask me questions throughout the presentation. Don't feel like you have to hold anything till the end. This can very much be a conversation. I give this speech, actually a modified version of this speech, to every new person that comes through Community Health Center, as well as some community opportunities within Crawford County and in Southeast Kansas too, just to talk about other aspects of health and some of the parts of health that people don't necessarily think of when they think of health, and what places like Community Health Center are doing and what other community organizations like libraries and other places can be doing to think about the health of our communities more than just how long do you live, how great is your life while you're alive, that kind of thing. So poverty in Southeast Kansas, like we said, I am Karlea Abel. I, of course, am going to start with COVID vaccinations and just tell you my story and tell you my why. So I got COVID vaccinated to protect my family, to protect my daughter. I had a baby in April 2020. So my very first little baby in April 2020, at the height of when we didn't know anything about what was happening, I pushed with a mask on. So if you've had a kid, you know exactly what I'm talking about. That was the reality of having a pandemic baby. So I got vaccinated to protect her. I got vaccinated to protect my elderly parents, especially my father, who has history of respiratory illness and things too. So I did, he just did get vaccinated. So I'm very happy for him. It's everyone's personal choice, but I wanted to tell you my personal choice was to get vaccinated, and that's why. So we are the Community Health Center of Southeast Kansas. Like she said, we're located mainly in Pittsburgh, Kansas. We're also kind of all over a 9 to 10 county region in Southeast Kansas. I've got a list of our major locations there. We've given over 45,000 COVID vaccines to date. We give tens of thousands of flu shots and childhood vaccines and pneumonia vaccines and stuff every year. It's one of our founding principles, actually. We were founded in the Family Resource Center, which is a really large nonprofit child care center located again in Southeast Kansas, and with the idea that we wanted to get kids ready to go to school. So, well, child checks, childhood vaccines, whatever they needed to get ready to go to school, you start that conversation, and then you look at mom and she's got postpartum depression, you look at dad and he's got diabetes, and you think, wow, there's no healthcare system in Southeast Kansas that takes care of those folks too. And that's kind of how we got started to where we are today. We're the largest health center in Kansas. And we're the 83rd largest FQHC in the United States and the 15th largest all rural FQHC as well. So we're pretty proud of our growth over the last couple of years. We take care of over 65,000 patients. We have 150 providers, medical, dental, behavioral health. Not spending too much time on this, just want to give you a quick background of kind of who we are. This is our mission statement. It's on the back of our badges too, and it's all over our clinics. This is actually a picture I took of a mural or a big display that we have in our Pittsburgh clinic. It's do all the good that you can for all the people you can and all the ways that you can for just as long as you can. So we see all patients regardless of their ability to pay. So we have a sliding scale discount schedule for patients. So we literally take care of the richest of the rich, poorest of the poor. We take absolutely every single insurance company. And then we also take care of uninsured patients. So what that can mean is if people who qualify based on income, they can see a medical provider for as little as $25 per visit. That includes seeing the provider. That includes any x-rays that might happen during that visit as well, just kind of labs, anything that kind of happens with that. And then we also have a lot of pharmacies in our system too. We have a 340B pharmacy, which means that we can pass on savings to our patients as well. So obviously very grateful, very much in love with what Community Health Center does, very proud of it, and just kind of so you guys can see kind of what we're all about. We've grown a lot in the last couple of years. Like I said, we're continuing to grow. This is just a quick area of our service map, so you can kind of see our what we call the 4-state region, right? The dark areas are where the top 75% of our patients come from. So we're mostly in, Bourbon County, Lynn, Crawford, Cherokee. We actually do have a clinic in Northeast Oklahoma as well. We don't have clinics in Missouri, but we certainly have a lot of patients that come and find us or work in this area and also see us for their medical needs or dental needs as well. I'm going to kind of skip through this. We kind of talked a little bit about this. We're a mostly medical practice. We do offer dental, behavioral health, enabling services too, which is the things that we're going to talk a lot about today. It's a very small percentage of what we do in terms of visits, but they are much longer visits that we have with people. You might talk to a physician for 15 or 20 minutes. With a community health worker, it might be a couple of hours. Another just real cool thing we've got going on is that we are opening a rural residency program in Pittsburgh, which means that physicians will actually graduate from KU in Pittsburgh. If you know anything about residency programs, that's like a really big deal for us. It's a really big deal for any healthcare system to have a residency program. And what's really neat about that is that we get to pick our residents. So, we're looking for kids from rural Kansas that want to become doctors and hopefully stay in rural Kansas. And wherever it is they may practice, we hope it's with us, or we hope it's with, somewhere in an underserved area. So we're getting a brand new building to have an auditorium. It's got all kinds of neat things to help students learn. We did some fundraising for that. It was really great. And we have a lot of students. We have nurse practitioner residency program. We have social workers, law students, nurses, all kinds of things. On a given year, we have about 250 students that come through our doors. Out of a staff of 650, you can understand we've got a lot of students running around. So this is what we call enabling services, which I'm going to talk more about as I go through and talk through like kind of the definition of health. And so that's where I'm going to start. What is health? What do we mean by that? And I'm a huge data person. So if you can't tell already by my slides and the maps and the statistics and things, I really like to look at data. And just kind of like, what is the black and white definition of these things? So World Health Organization definition of health, it's a state of complete physical, mental, and social well-being, not merely the absence of disease or sickness. Right. And I think most people understand that, right? That's like, it's kind of like common sense, right? People know that, right? Just because you don't have diabetes doesn't mean that you're healthy, right? Just because your BMI isn't over 30 doesn't mean that you're healthy. You can be skinny and very unhealthy, right? You can, all kinds of things. You could still have high cholesterol. You could be at a higher risk for cancer. You could be lonely. You could suffer from some behavioral health issues as well. So it's not just, do you have disease or do you not have disease, or how long you live? It's not just those things. The definition of health is all of those things put together. So here's where the data comes in. There's a great model of a definition of health from the Robert Wood Johnson Foundation. This is countyhealthrankings.com. It's public information. You can look up your county. You can look up any county in the whole United States and see how it ranks. And they rank the health based on two different things. First is health outcomes, which is absolutely what you think of when you think of health: mortality, morbidity. How long did you live? How healthy were you? Then there's health factors, which all contribute to your health outcomes. So health factors are behaviors, clinical care, social and economic factors, and physical environment. So what absolutely blows my mind about this, we talk about health, we talk about the health and well-being of communities and of people. And usually when people talk about healthcare, they are talking about the 20% clinical care. And if you break that down even further, 10% of that is access to care, and the other 10% is quality of care. So access to care is, do you even have it? Are there primary care physicians in Cherokee County, Kansas? Are there enough dental providers, enough behavioral health providers? Can you get there? Do you have transportation to go and access these different things? So half of the clinical care piece is just, is there enough of it and can you get there? The other 10% is what dominates 99% of the conversation, which is quality of care, right? Does your provider prescribe the right things? Do you, can you get in to see them? Like, you know what I mean? All those different things of what you would define as quality. And then what we're mostly talking about today is the social and economic factors, the powerhouse of the health factors section, 40% of that. Education, employment, income, community safety, family and social support, even physical environment, environmental quality, and built environment. Environmental quality is a huge issue in Southeast Kansas. We have a long history of mining. We have I think we have 4 active EPA Superfund sites, which means environmental disaster sites, because these big heavy metal companies came in and they did a bunch of mining. They brought up a bunch of the heavy metals to the top of the surface. And now we've got lead poisoning issues, right? We've got lead and zinc and all these big heavy metals in our topsoil, which is a huge environmental quality issue. And then I think about things like, built environment and community safety. Do you have a sidewalk outside of your house where you can go for a walk? Or do you live in a rural area where there's not enough room for 2 cars to go past each other and people drive 70 miles an hour down the road? You know what I mean? So it's not only just like, is there a sidewalk, but is the street safe enough? Do you have a built environment that allows you to get places, allows you to enjoy physical activity outside for free? And, just the general community safety. Is it okay for you to walk your dog at night? Those types of things as well. So I'm going to show you Kansas. So here is health factors. So just what we just talked about, the behaviors, the choices, the economic environment of those different things. So out of 104 counties, Southeast Kansas and Wyandotte County, we hang out in the bottom 25 percentile for all those different health factors. So it's not good. If you were to rank all of the states all together, Kansas in terms of overall health, I think it's like we rank like, somewhere in the 30s, right? 32 out of 50 states is Kansas. If Kansas could cut out Southeast Kansas, it would rank 10th. So there's not only are we at the bottom 25 percentile in Southeast Kansas, there is a significant difference between a place like Johnson County and a place like Southeast Kansas. If you look at Montgomery County and Johnson County, the difference in life expectancy is about 8 years. So if you grow up and you live in Montgomery County, statistically speaking, you will live 8 years less than somebody who lives in Johnson County, which just absolutely blows my mind. And also, of course, you think about the distance between Johnson County and a place like Bourbon County. I mean, what is that? Maybe 60 miles, probably not 60 miles, probably less than that. We're talking about very small distances away from each other, but in terms of economic environment and health environment, incredibly different. I'm sure this is maybe not news to a lot of people here. If you've been to Southeast Kansas, I see a couple people with library names in Southeast Kansas, so this is probably not necessarily new. I threw in health outcomes just to completely show you here, but of course, not much different here. So health outcomes, mortality, morbidity, not much different. We have really high rates of hypertension, really high rates of diabetes compared to other areas. That's all going to contribute to your health outcome stuff. So I'm going to pick on Crawford County. Crawford County is actually kind of like our little bright spot in Southeast Kansas. It's our highest ranking county from county health rankings. So I pulled out the social and economic factors. Purple are good things. Those are things that help contribute to a better ranking. And then the orange is bad. It's what contributes to a lowering of our ranking. So we have some things going on here that are good. High school completion is great. That's good. Some college is a little bit higher. That's probably to be expected. We have Pitt State University in town that makes up a large portion of our population. Injury deaths actually is pretty low compared to the Kansas state average, so that's good. And then we look at unemployment is higher than the state average. And then our income inequality is a lot higher than the Kansas average, and also when compared to top US performers. So income inequality is it's a ratio of houses that are at the 80 percentile of wealth, right? Versus the 20 percentile of wealth or income. So, which is kind of, it's on my next slide here, but we have a lot of like severe housing issues. And part of that has to do with the fact that like, it's really easy for some reason in Pittsburgh to buy a house that is $300,000 or $50,000. And there's not a lot in between. So that is that in a statistic format, the income inequality, that is exactly that point there. And then of course, the thing that keeps me up at night is that children in poverty percentile, 20% of our kids live in poverty. That's actually pretty good compared to some other counties in Southeast Kansas. And it's also trending a little bit better for us over year. And I break it down on another slide coming up. Another part of health factors is physical environments. I already talked about this just a little bit. So severe housing problems is a huge issue. 18% of our households have some type of severe housing issue. Anecdotally, we hear a lot of things about people don't have functioning appliances, even though they rent and they should. We have food pantries in our clinics now, just as of a couple of months ago, and people don't have can openers. So we have these cans of food, great, low sodium, no sugar added, healthy foods, awesome thing for us. People don't have can openers to open those. So we really have to focus on purchasing the pop tops or finding can openers for people so they have access to those things. So people, that is a huge issue that we have. And then of course I gotta be Erin Brockovich just for 30 seconds and talk about air pollution, drinking water violations, and things in our physical environment as well. And I have to imagine that has a lot to do with, again, our Superfund sites. We've got these big giant chat piles in Oklahoma and in Cherokee County, which is, these it's a crazy picture. If you ever get lost in Google Maps for just like 15 seconds, go into Pitcher, Oklahoma, and look at the big piles of chat that we've got that is all completely contaminated. Okay, so Crawford County, here we go. So we are 83rd out of 104 in health outcomes. We are 90th out of 104 in health factors. Again, that's pretty high compared to other Southeast Kansas communities. 20% of our kids live in poverty. If you haven't seen the definition of poverty recently, I threw it on here as well. It's actually what we call our slide A at Community Health Center in terms of what people qualify for medical discounts and dental discounts. So let's pick on, so look, the idea, family size, maybe a family size of 2. So a kiddo and a mom, single family household with 1 kid, 1 mom. The definition of poverty is an annual income of $17,000 per year. If you wanted to make it a household of 3, mom, dad, and a kiddo, that's a household income of $21,000. That is the definition of poverty. So just to throw that out there, 20% of our kids live in poverty. And, one of the things that we talk a lot about in Southeast Kansas is the idea that we have a lot of generational poverty, which is just the definition of, 2 or more generations living in a status of poverty. Other counties can look a little bit different. It's more like situational poverty. So like, maybe in Johnson County, there's less generational poverty and it's more situational, right? People who live paycheck to paycheck, but they're doing fine as long as they have a paycheck. If they miss a paycheck for whatever reason, quarantine for 10 days, get COVID, get sick, have a maternity leave that's unpaid, whatever it may be, as soon as they miss that paycheck, they're now in a situational poverty situation because they're living paycheck to paycheck. What we see in Southeast Kansas is a lot of generational poverty, which I'm hoping to talk more about today too.
Karlea, we had a couple of questions in the chat.
Yes.
I wanted to know on this slide, is this by county? And is this a federal definition?
This is a federal definition of poverty. So yeah, it's this exact same, unless the only difference is like Alaska and Hawaii have their own federal definitions of poverty. But otherwise, if you're in Kansas, this is the definition of poverty.
Thanks.
Yeah, thanks for pointing that out to me. So 20% of kids living in poverty. I would say that I'm kind of interested in people who are low income, right? Because that number is probably higher. So one proxy that I have for that, this slide's a little bit crazy. This is the percentages of kids on free and reduced lunch, which by definition is up to 185% of the federal poverty level. I would probably call low income up to 200% of the federal poverty level. That's kind of like a standard definition of low income, not poverty. And so this is pretty close, right? These are this is not totally inclusive, but this data actually came directly from the K-State Extension Office here in Southeast Kansas. So you've got the numbers of the, USD 250 is Pittsburgh. You kind of see the different things here, but one of the best elementary schools that we have in the nicest neighborhoods here in Pittsburgh is George Nettles Elementary School. And that is about 52% of those kids are on free and reduced lunch. You've got Chetopa, which is down, I believe that's Montgomery County. It's like right on the line, right? Cherokee, Montgomery, I think it's Montgomery County. Chetopa Elementary School, 74% of those kids on free and reduced lunch. What's another one? Field Kinley High School, that's also in Coffeyville, that's Montgomery County, that's 73% of high school students are on free and reduced lunch. So I say all that to point out how much our health factors impact the health of our community, and also what we can do, what community health centers can do, what other nonprofit organizations can do. We need to understand the layout, right? We need to understand the data. We need to understand where people are coming from, because I think that there's kind of this misconception that it's a very small percentage of people, right? It's like people over there, or it's or people maybe not even recognizing, which is something we work on a lot. People don't recognize that they live in a low income situation where they may have access to resources. They may be eligible for Medicaid. If you get eligible for Medicaid, Medicaid pays for patient transportation to medical appointments or reimburses you. So even if you have a car and you've got a way to get there, you can get reimbursed for Medicaid for that public transportation. Some Medicaid programs have cell phones for people, right? They help, and they're not iPhones, but it's a cell phone. It's better than nothing, especially if you're, elderly or you're living in a rural area that's kind of disconnected. Helps pay for cell phones. Other programs can pay for things like Life Alert, right? You've seen those commercials for older folks that they have like a button they can push if they fall or if they're in a bad situation. So I think that something that we run into a lot is, of course, being in a low income environment. People don't know what's available to them. They don't know what the resources are. And either it's because they don't recognize that they qualify for those things, because maybe they live in an area that is pretty high rates of poverty or pretty high rates of low income. And or, of course, we have a lot of pride, right? So people don't want to take advantage of something. They don't, we work with a lot of senior citizens who qualify for SNAP benefits, which is food stamps. And it's not a lot. In some cases, it's like $25 a month. And people will say, well, I don't want to be one of those people that takes advantage of these services, or right. But if you did, if you were walking in a parking lot and you saw $20 on the ground, you would bend over and pick it up, wouldn't you? Right? Like if you had access to these things, and maybe that $25 that you were getting from SNAP now frees you up to buy something like a ride to your medical appointment, or maybe you could spend a little bit more on fresh fruits and vegetables because you're buying a lot of, frozen things, or a lot of things that are very high in sodium, or you're going through, a lot of fast food restaurants and things because you think it's more affordable. So all of those things can kind of contribute again to kind of that perpetuation of not having enough, and then not having enough to be able to do things like drive a little bit further to the nicer grocery store that has those fresh produce items. So maybe just sticking to Casey's or sticking to the gas station or convenience store to buy all of your food.
I hate to interrupt.
Go ahead.
There's things in the chat that I'm afraid we're going to miss.
Yeah.
Someone says, how is this data correct when right now schools are offering free lunches to all students? And then someone else said, not all schools are offering free lunches right now. And oh my goodness, it goes on. Yeah, there are some on here that are for sure just wondering how the data is collected.
The schools actually still have to collect this data. So even though they're still getting, even if the school district is offering free lunches to all kiddos. This information, getting kids enrolled in the free and reduced lunch program, affects other programs and affects kind of like reimbursement and where the money comes from for these free lunches. So it's actually very, very important for schools that they get this information as comprehensive and as complete as possible.
Thank you. Other people are saying, yes, I also wondered the same thing. And thank you. And somebody else explained the same thing when they signed their child up. Okay, thank you. I just want to make sure we didn't lose all these.
Yeah, thank you. I can't tell. I clicked on the chat once before and it was like people just checking in saying hi. So I'll try to keep my eye open too.
No, that's what I'm here for. I can do it. Don't worry about it.
Okay, so this is a quick slide on the cycle of poverty, right? So we talked about, again, generational poverty and what that means. And also maybe how people like libraries have a really unique opportunity, how a lot of organizations have a unique opportunity to really talk about kids and work with kids and lift kids up. Most research stuff that talks about breaking the cycle of poverty talks about children. It's our best opportunity. There's lots of evidence, there's lots of research base out there that talks about, even in our clinics, we give kids books when they come for their well child check, because it's, talking to children, reading with children, those are all really great ways. So the cycle of poverty is, you grow up in a place where you're in a home or a household or a family where there is hunger, there are poor health, and there's poor living conditions. There's a lack of education, whether it's because the school is not so great, I don't know, or is it more like you don't have family and friends and an environment in which that's encouraged, or where that's a fun place, where that's a fun, safe place to go and not just something that you have to do, or it's not reinforced at home, or there's no, one's helping you with homework and that kind of things. So lack of education leads to a lack of opportunity. If nobody pushes you and tells you you'd be really good at trade school, or you'd be really good at insert college or career opportunity here, if nobody grows you into that position, that's a very hard place to get to on your own. So that lack of education leads to lack of opportunity, which leads to a low income environment, which continues that cycle of poverty. So all of those things, kind of bringing it back to the healthcare part of it: poverty, poor housing, unemployment, lack of education, inadequate food and nutrition, environmental health hazards. You're more likely to live in a rental that has lead paint. You're more likely to live in a place that is more contaminated. Whatever those things are, all of those build up on the idea that you're going to have a tougher time in life and your health outcomes are going to be worse. There's just so much data that's about that. And that's why 40% of the health factors that affect your health outcomes have to do with where do you live, your employment status, your educational status, all of those things pile up there. And then of course, on a more just like basic common sense level, do you care about breast cancer screening if you're not sure how you're going to pay your rent this month? Do you? Probably not, right? Because you may know intrinsically that it's important. You may know that might be like in the back of your brain, yeah, that's important, but it is just a screening and it is just preventative in nature, right? And you probably don't have breast cancer. But at the same time, if you delay that, it's an early detection thing, right? Early detection does work for a lot of our cancers, for a lot of our health outcomes, for a lot of our things. So if you are delaying healthcare for any reason whatsoever, that delay causes worse health outcomes because you're not catching it early. You're not aware of those things that maybe you could have gotten in front of, you no longer can get in front of. If you knew that you had high cholesterol, if you knew that you had high blood pressure, maybe you wouldn't have had that bad outcome, but you delay all those things because of all of these health or all these social economic factors. This is what we call the social determinants of health. All of these things are the social environment, the economic factors that actually have a very real effect on people's health outcomes and people's health factors. A really good example I have is that we have a population health department which does outreach to patients and says things like you're due for mammograms and you're due for a blood pressure check. And we had just hired a dietitian and a wellness coordinator who's an athletic trainer in our Pittsburgh location. So to kind of celebrate that, we started a blood pressure reduction challenge. So we reached out to patients that had high blood pressure according to our chart details. And we said, we have an 8-week program. During this program, we're going to give you a blood pressure cuff. We're going to give you a scale. You're going to get to meet with our dietitian, with our wellness coordinator, with your primary care provider. We'll get lab work done. And at the end of the 8 weeks, we hope to see that your blood pressure has been reduced. Wildly successful program. But one thing that happened was that we reached out to somebody. She was 65 years old, living in a very rural part of Crawford County. And she said to us, I know this is a problem, and I would absolutely love to be a part of this program because I know that I have high blood pressure and I get headaches from high blood pressure, which is a really bad sign. But she said, it's Tuesday and I've got a bag of Cheetos to eat before Friday. And that's all I have. And I just can't worry about this. I can't think about my high blood pressure because I got to worry about my grandkids, and I got to worry about the fact that I don't have food to eat before Friday. So of course, our community health worker ninjas, go into place. We brought her some Ensure. We got her connected to the SNAP benefits, and we got her connected with some food pantry items to hold her over until Friday, and also got her connected to those additional resources. She did join our blood pressure reduction challenge, but a month later, and she had really good outcomes. And we made a really good friend in the process, and we were able to connect her to resources. I think that's just kind of like that idea compounds on itself. The people don't know. They don't know what's out there. They don't know how to access those things. Maybe they feel guilty for accessing those things, not realizing, if they can take better care of themselves, you can take better care of those grandkids. You can, use that extra $25 a month to buy healthier foods, which is great for everybody, right? Okay. I'm moving on. So children in poverty, this is Crawford County again. So no significant long-term trend in Crawford County. However, it's improved in recent years. You see Crawford County, Kansas, and United States. So almost across the board, we've kind of had a little bit of a downward trend. And I'm going to kind of fly through this part a little bit because just to be cognizant of time too. So we look at children living in poverty in Kansas. If you break this down around racial and ethnic groups, you can see that little orange ticker mark is the state average, and each of those little red circles are each of the counties in Kansas. So you can see things like Black kids, Hispanic kids have higher rates of children living in poverty than white kids, for example, and just the overall where the state value is versus the national value is compared to all these different things. So we've got really good data on this. And I point this out because health inequalities, inequities, what I want you to get from this slide, it's avoidable. When we talk about these things, we're talking about the things that we actually have control over and things that are actually avoidable. I'm not talking about genetics. I'm not talking about things that we don't have control over, right? I'm talking about how and why people access different things for different reasons. If you're familiar with very rural areas, think about an elderly person who lives downtown Pittsburgh, close to a fixed route bus public transportation system, versus somebody who lives in Arcadia, which is a very, very, very small town between Fort Scott and Pittsburgh. You have to try harder to reach the person who lives in Arcadia, right? That is a health inequity. That is an inequality. You have to do different things to reach the people that live in Arcadia versus the people who live in Pittsburgh. And that's just within our own county. Take that times lots of different cultural differences, different languages, different geographies, different perceptions of health. Even people who come from lower income households have this conception that they ain't going to go to the hospital unless they're dying. They're not going to go to a physician for a wellness visit, because why would you go to the doctor when you weren't sick? Which is, of course, in case you didn't know, you need to go to your doctor every year for your wellness visit, whether you're sick or not. So here's a little bit of a cartoon, talks about equality versus equity versus liberation, right? We've seen this before. This is pretty popular. So when we talk about equality versus equity, there's your equity. You're gonna have to try harder with certain populations. I know when somebody comes into our clinic and they say that they're a farmer, I'm gonna have to try harder. I'm gonna have to put more effort to talking to that person about anything health related. Flu shots, COVID vaccines, getting labs drawn, checking their cholesterol, taking home a blood pressure cuff today. That is what equity means. And that's how we can apply it to lots of different slices and dices of our population. So something that just drives me absolutely crazy. I just learned this information recently because the county health rankings recently updated. This is the percentage of children living in poverty in Crawford County, Kansas. So the Black kids in Crawford County, 74% of them live in poverty versus each of the other breakdowns here. If I go back, here we go. If I go back to this slide where you see all of the kids, see that red dot all the way to the right, the highest value, that is Crawford County, Kansas. And when I saw this, I was like so upset. I was very, very upset. I went into the data because I was thinking, well, okay, so like, you know, our community is like 95% white. So maybe the denominator is really low, right? So maybe it's like 10 kids are living, 10 kids are Black and living in Crawford County, and therefore 74% of them is like only 8, right? And maybe it's just like a small number, just a high percentage. No, you look at it, we're talking about a couple hundred kids. So we use all of this data, all of this, because we think about our different populations now, right? You've got people who can't access things. Maybe they know that they have resources, but don't access them because they can't. And then you've got a lot of people who just don't even know what they qualify for, don't even know what questions they should be asking. And it's what we all need to do as organizations that take care of the entire community, that want zero barriers to accessing our services. We need to understand this data. We need to understand who lives in our communities, why, all of these different things, and who are the people that I need to try harder on? Who are the people that I'm really looking for when they walk in my building? I'm going to think, what about them? I'm going to think about the farmer who has no transportation. I'm going to think about Black kids. I'm going to think about Hispanic kids. What am I doing and why? Because I know my goal is that 100% of people have access to everything that they need, and also want to access those things and understand why it's important. This is a quick slide also just to point out, we have a growing population of Marshallese in Southeast Kansas. There's a big community in Arkansas, and they're kind of slowly migrating also to Pittsburgh and to other locations in Southeast Kansas. Just want to throw this out there if that's something that's happening in your community as well. These are legal residents of the United States, and they do qualify for Medicaid, and they do qualify for all of the things that a natural born American citizen would qualify for, because they are legal residents of the United States. So of course, we think about, again, different subpopulations that can be a barrier. Citizenship can be a barrier to accessing those different resources. Here's a community that is not one of them. Language barrier, absolutely. Cultural barriers, absolutely. But at least there's not citizenship concerns when it comes to accessing things like SNAP, Medicaid, all those things. Okay, other barriers to healthy life: health insurance, knowledge of and ability to complete the 30-page application that you need to complete for Medicaid applications, and SNAP and WIC and senior food boxes and Meals on Wheels. Transportation is by far the biggest barrier we see for anything in our region. Medication costs, access to healthy foods, and then of course, homelessness, housing, and other related issues. Dangerous stairs for people who have mobility issues, being able to pay for utilities, or, as we've talked about more and more in recent years, heat waves have a really profound effect on elderly patients or elderly people who don't have access to air conditioning. That can cause some bad health outcomes as well. Functioning appliances like refrigerators and stoves, and just the ability to cook. One thing that was really important to us when we started our food pantries was that I wasn't just going to hand people zucchinis, because not everyone knows what to do with the zucchini, right? So we focus on things like corn and canned corn that is low in sodium, and fruits and that are in no sugar or very low amounts of sugar, the least amount as possible, or fresh versions of those things so people actually know what to do with those. And or if I do have zucchinis and I'm handing you a zucchini, I'm also handing you a recipe card or how to prepare this item card and how to try new different healthy options of things. So that's all part of some of the barriers that we try to work on as well. Okay, so I've got a quick analogy for you. Back in the day, or in maybe some areas, right? What did you used to do? You would go to the butcher shop to get your meat. You'd go to a bakery to get your bread. You'd go to a separate hardware store. You'd go to a separate pharmacy, and you'd go to a separate toy store. And there was a lot of pros to this, right? It's really high quality stuff. It's people who are professionals at those different things. But one of the biggest cons of all of this is that if you've got 5 things to get, you've got to go to 5 different places. Now, how hard is that if you don't have a car? Or how hard is that if it takes you 5 to 10 minutes to get in and out of your car each time? Even if you just have kids, right? You've got 3 kids, you've got 3 car seats. That's a lot of work, right? Putting kids in car seats and kind of going in and out and going to all these 5 different places. That's a lot. And, you know, if you happen to be in the butcher shop and you've got a question about bakery items, it's not like you can ask the butcher about the bakery, right? You can't do that. There's a lot of pros to this model, but there's also a lot of cons to that. So what do we have now? We've got Walmart, right? You go to one place and it's literally everything. It's got food, it's got pharmacy, optical, photo, tire. Literally everything you could need is at Walmart. And there's a lot of pros to this, right? It's one big giant place. A lot of people need to go there. So maybe it's on a bus route, or maybe it's just a little bit easier to get to. Or if you're asking a ride from your neighbor, they're probably more willing to take you there because they're probably also going there. It's co-located with all of these things, and maybe you actually might get some better pricing, some better services, because if I'm in the food section, I've got questions about pharmacy, I just walk to the other side of the building and now I can get my questions answered about pharmacy, right? So we take that same idea and apply it to your community organizations. So you've got CanCare, which is Medicaid, and this is mostly Pittsburgh, right? Safe House Crisis Center, right? Domestic violence, women and children and families who need a safe place to go. Wesley House, which does daytime homeless services and case management. There's SNAP, which is the food stamp stuff. There's the Housing Authority. There's the Lord's Diner, which offers a free meal, no questions asked, in Pittsburgh every single night, 365 days a year. You've got the Community Health Center of Southeast Kansas providing medical care, dental care, behavioral health care. That's great. We have a lot of things that we can do in our whole system. But what continues to be really, really difficult, even for places like Community Health Center, where we try really, really hard to be experts on stuff. If I've got a question about Medicaid, can I go to the Lord's Diner and ask them about that? No. If I go to the Public Housing Authority and I got a question about food stamps, can they answer that question? No. It's really, really difficult when you need lots of different things, which people in poverty or even crisis situations or situational situations. Think about the family that lives paycheck to paycheck, right? You could have gone your whole life living paycheck to paycheck, surviving at every moment, never needing access to any of these services or any food pantry ever. And then bam, you just got put on I've heard some people, because of symptoms and exposure, they're on 20-day quarantines, right? So you can't work for 20 days. Now you are in situational poverty, and now it's I need the food pantry, right? Or I need access to these things, or maybe I need to go to Lord's Diner. If you don't have cell phones, if you don't have access to all of those things, if the internet is hard, some food pantries don't have websites and things. That information is difficult to find. That's a barrier, right? Because there's not like one place you can go and find all that information. Okay, so you know what my next slide is, right? This is the Pittsburgh Public Library. It's a great place. So what I'm here to talk about, of course, I'm here to talk about poverty and health and economic environments and things all that affect that stuff. But people love libraries and they trust their libraries. So something to think about. And maybe this already happens, maybe everyone already knows what I'm talking about, but something to reflect on is libraries are usually in a good location. Usually they can get rides to them. Again, it's not like you're asking for a ride to, somewhere off track, right? It's usually in a downtown location, so maybe slightly easier to get to, or on a bus route of some kind. It's free, it's air conditioned, it has internet, there are computers there, there's lots of resources, there's friendly individuals that smile at you and don't make you feel unwelcome, no matter what your question may be. libraries could be a really good Walmart of resources. It could be a really good place where people could show up and say, I need health insurance. What do I do? And those are hard questions to ask. Those are hard questions to answer. So something that we could think about is how can all types of community organizations work with libraries? How can libraries work with us so that more places are one-stop shops for information, so that you can walk in and ask the butcher about the bakery, right? I can ask the library about health insurance and food stamps and where the food pantries are and how do I get there and what are the hours and like what form do I need to sign to make that happen. So now I've got, hopefully not too cheesy quotes, to quote some quotations here. So bear with me if these are a little bit on the cheesy end. But something that all of these things just really resonated with me as I was kind of preparing for this. So reading gives us some place to go when we have to, reading gives us some place to go when we have to stay where we are. I love that, right? I feel like that just encapsulates what we're talking about. Albert Einstein, the only thing that you absolutely have to know is the location of the library. I don't need to know where Safe House is. I don't need to know where the food pantry is. I don't need to know where those things are. If I can just know where my library is, and I can just build that relationship, and I can understand that if I need a question answered, if I need a friendly way to find the answer to X, Y, and Z, whether it's about my science homework or my math homework, or I want to know more about Albert Einstein, or I want to know how to get health insurance, maybe that could be a library. Okay, more cheesy quotes. Bad libraries build collections, good libraries build services, great libraries build communities. And that's exactly what we're talking about, building those communities with different organizations. And then the OG, Andrew Carnegie, a library outranks any other one thing a community can do to benefit its people. It's never a failing spring in the desert. So I love that. And of course, I'll end here. We've got a little bit of time. I'd absolutely love to hear from you guys. I see we've got more chats lined up here too. So would love to answer any questions. Would love to talk about libraries or community organizations or the effects on health and community building and all that stuff. Would love to hear from you guys.
I do want to share with you how many of our libraries, and I was really excited when I discovered this, they have food pantries. A lot of our libraries have really stepped up into that role with the whole food desert, with fresh produce, with working with extension for the cooking classes and canning classes and checking out things. So a lot of our libraries have what we call a library of things, and they have cooking utensils that you can check out at the library. So can openers, we could check out can openers at the library. So some of our libraries have already sort of picked that up and saw that need and are filling it. And I think it's very admirable, and I was excited. So.
Yeah, resource lists are kind of like a never-ending thing. We work on them so often. We do have one here for Pittsburgh, and actually, K-State Extension has worked in various areas, has worked really hard to make a comprehensive food list that has where the meals are, where the pantries are, where the blessing boxes are. If there's any requirements, some food pantries have like an income thing on those, right? So like what are the barriers, if any, or eligibility requirements, if any, for each of those things. And I think, in some a lot of areas also have like coalitions. So I know like Crawford County has a pretty robust coalition that's made of mostly social service organizations like the Family Advocates and Community Health Center and just, the Healthy Families and the Birth to 3 folks and like a bunch of people that kind of work together. And we also talk about resources all the time. So I think it's not like a thing that you like create and like forget. It's like a thing you create and have to update every month probably, or every couple of months. But definitely something that I'm happy to share with what I have. I don't have a lot for places outside of Crawford County, to be totally honest.
I agree with Kim that we can, that's a role that Southeast Kansas Library System can help with, is to partner with everybody to get some of the resources that everybody needs. And I would urge all of my librarians to invite yourself to that table. If there's a coalition, make sure that you're part of it. We recently did that here in Iola and got to meet with people, community health workers, and found out that the broadband and internet that we have was really life-changing for a lot of people who are fighting poverty. So
I also think it's important for even the smallest libraries to realize that they may know more resources than they think. You need to talk about this and maybe show this presentation to other staff members, to your boards, because it will turn out that, just like Sharon, you have somebody who's on a board of a local community grocery. You have somebody who's on a board of a church that has a safe place, or you have somebody who is a coach. I know coaches and teachers frequently know a lot about what kids and families need, and you need to network in your communities, even if in the smallest communities you don't have the formal setups that maybe they have in Crawford County. All the libraries can do that.